lasting powers of attorney, or LPAs. Can you explain a little bit about what they are and where they come into effect?
Yeah, so there are two types of lasting powers of attorney, one in relation to your property and financial affairs and one for health and welfare. The property and financial affairs power of attorney, you as the donor, you make it and you decide who your attorneys or attorneys are to deal with your finances. So it covers your property, dealing with your bank accounts, dealing with HMRC, anything to do with money. You can tick a relevant box to say I want it to be used with or without capacity. So I have some clients that have mental capacity, but they might have had an accident or be very frail and they don't want to manage their affairs anymore. So they give consent for their attorneys to use it. Normally it's used when that person's lost capacity and they manage those finances. The health and welfare power of attorney is the other type, and that's if something happens to your mental capacity, so it's only used without capacity, and it's your general health and welfare, so things like where you are to live, care arrangements, medical treatment. You can even sign a box if you want to in the relevant document for life-sustaining treatment, so for your attorneys to be able to give or refuse consent to life-sustaining treatment. So the medical practitioner knows to go to those family members or those attorneys to have a discussion with them about life-sustaining treatment. Again, they're awful, awful conversations to have. But once it's down in the document, the family at the worst time of their life needing to make a decision, they know what your wishes are. So both are really important. They have to be registered with the Office of the Public Guardian before they can be used. So we would normally make them and register at the same time. You have to have capacity to make a will and a power of attorney, so don't leave it until it's too late. Had an influx in the pandemic, absolutely. I was doing so many powers of attorney, and one of the reasons being is you might know Kate Garraway, the presenter, and her husband. You know, in the pandemic, he was only in his 50s. He was in coma for a long time with COVID, and he lost capacity. And she was really, really vocal about it. They didn't have powers of attorney. They're in their 50s. They didn't think about it, and she couldn't manage his affairs. And I think at one point her car was stolen or broken into, and the insurance was in his name, so she couldn't do anything about it. So if you don't have a power of attorney and then lose capacity, the only alternative is something called a deputyship order, and they are very lengthy and costly. You have to apply to the Court of Protection for the order. It can take 12 months plus, sometimes cost thousands of pounds. And in the meantime, who's managing your affairs? Who's looking after things? It's like insuring your mind. I know that sounds, a bit cheesy, but it's just saying if something happens to my capacity, these are the people that I want to deal with my affairs. These are people I trust. It needs to be people you know and trust. It can last forever. So, you can have an attorney, it might be your spouse, and then replacement attorneys that might be your children or close friends or someone else you trust. I think a lot of spouses don't realise that any joint accounts are fine, but anything else you can't access. So even though you're married, they'll say, oh, but we're married. Just because, my husband's lost capacity, he's had this awful accident, I need to access the accounts. They can't without the power of attorney, so really important.
Which I guess can have knock-on implications for things like paying mortgages and things like that as well.
Yeah.
So I know that people might sort of worry about, well, actually, if you get power of attorney, is someone going to then misuse it? So who decides if they've got capacity or not? How does that happen?
Yeah, that's a good question. So when the lasting power of attorney is signed, it needs to be signed off by a certificate provider, and that's someone that's known you over 2 years, a medical practitioner or a professional. So we would act as a certificate provider, but we know what the rules are and what capacity level you should be at to do it. If there's any doubt, we would involve a medical practitioner. And often it's heartbreaking because every time a client makes a will, I talk to them about power of attorney. And sometimes, not often, they'll often do both of them, but sometimes they'll say, we'll come back about the power of attorney. And one of the reasons they do that is they do feel like they're giving somebody else power now, which they're not, but they do feel like that. So they say, I'll come back. And then sometimes it's heartbreaking because they'll come back a couple of years later and you can tell that one of them has started to lose capacity and you're not comfortable with doing it. And it's too late. The only option is a deputyship order. And it's hard to give them that news sometimes in the meeting room.
Yeah, I bet. And if they lose capacity and someone wants to sort of activate, as it were, the power of attorney, how does that sort of come about?
Yeah, so normally it's registered straight away. There are different types. So the old type was called an enduring power of attorney, which isn't registered until you are becoming or have become mentally incapacitated. So until you've lost capacity to manage your affairs. So the lasting power of attorney is normally registered. We would hold the document for the client and we would only ever release it if the client asks for it because it's theirs, they can have it, and we need to meet the client, make sure they're okay. But if the family or the attorneys have contacted us saying they've lost capacity, we don't want to be difficult because we know they're going through a difficult time, but the client is our client, and we have to say we need to see a medical practitioner's report to say you're no longer capable of managing your affairs.